Draw the stocking smoothly towards the thigh. Check to be sure that the stocking is applied evenly and smoothly. There should be no wrinkles. Check the material on the toes to be sure that it is not too tight. Repeat the procedure on the opposite leg. Stockings should be removed every 24 hours during the bath or as directed by a physician. Apply a clean pair of stockings and wash the soiled pair in mild soap and water. Check the stockings periodically during the shift for proper fit. Make sure that they remain wrinkle-free and do not become bunched, creating a tourniquet effect. Another system that is impacted by immobility is the respiratory system. This system includes the air passages and the lungs. If you recall, our lungs take in oxygen and we breathe out or give off carbon dioxide and other gases. Immobility from sitting or lying too long limits our lungs' ability to expand and contract effectively. Gas exchange is compromised and fluid rather than oxygen begins to occupy the air spaces in the lung. Secretions develop and that increases the possibility of lungs collapsing, pneumonia developing, or any other kind of serious respiratory problem. Measures that you and other healthcare assistants can take to help prevent this from occurring are, first of all, moving and repositioning the patient often so that fluid does not have a chance to stagnate in the lungs. Another is have patients perform breathing exercises. Deep breathing and coughing clears the air passages of this fluid as it might accumulate. Please watch as two different respiratory breathing exercises are demonstrated now. Assemble disposable gloves, a box of tissues, and an emesis basin. Elevate the head of the bed and assist the patient to assume a comfortable sitting position. This can be done with the patient sitting upright in a chair as well. Explain the purpose for performing these exercises. Ask the patient to take as deep a breath as possible and hold it for 3 to 5 seconds. Then exhale slowly through pursed lips. Repeat this maneuver a second time. Pass tissues to the patient and instruct her to take a third deep breath and cough forcefully, collecting any secretions that are brought up in the tissues. Put on disposable gloves to handle the tissues. Dispose of the tissues in an emesis basin. Assist the patient to assume a new, comfortable position. This exercise should be repeated every hour while awake. Report to the nurse how the patient tolerated the exercise and any unusual responses such as pain, dizziness, or throat and airway irritation. Another type of coughing and deep breathing is with use of an incentive or inspiration device. The purpose is to improve inhalation by moving a ball or cylinder up a chamber while inhaling deeply. Assemble disposable gloves, box of tissue, water pitcher, paper towel, and emesis basin. Elevate the head of the bed and assist the patient to a comfortable sitting position. Explain the purpose for doing the exercises and review the procedure with the patient. Put on your gloves. Set the device, called a spirometer, to the predetermined volume. If you have questions about that, check with the nurse. Have the patient hold the spirometer's mouthpiece with one hand and the spirometer with the other. Have the patient exhale normally and then place lips securely around the mouthpiece. Have the patient take in a slow, deep breath until the piston is elevated to the predetermined level.